Can you bruise your clitoris? If you've ever wondered about this but felt too embarrassed to ask, you're not alone. Today, we're talking about something that affects more women than you might imagine. I'm going to share the real facts about clitoral pain and bruising, what causes it, when it's normal, and most importantly, when you should be concerned. We'll cover everything from everyday activities that can cause problems to treatment options that actually work. This isn't just medical information, it's about understanding your body and taking control of your comfort. Let's start with the basics. Your clitoris isn't just that small external area you can see and touch. It's actually a much larger structure, shaped like a wishbone, extending about 4 inches inside your body. The visible part, the glands, contain over 8,000 nerve endings. That's twice as many as the head of a penis. This incredibly sensitive area is exactly why your clitoris can experience pain and bruising. Those thousands of nerve endings combined with delicate erectile tissue and rich network of blood vessels make this area particularly vulnerable to trauma. So what does that bruising actually feel like? Most women describe it as a deep, constant soreness, similar to bumping your shin on furniture. You might notice a dull ache that's present even when nothing's touching the area, or throbbing sensations that feel like your heartbeat that you have a heartbeat in that spot. Now, what causes the pain? Sexual activity is the most common trigger. Vigorous positions, insufficient lubrication, or prolonged stimulation can create microtrauma to the tissue. But it's not just intimacy. Everyday activities matter too. Cycling with a poorly fitted bike seat, tight jeans with prominent seams, even certain exercises can put pressure on the sensitive area. Hormonal changes during menopause or from birth control can make tissues thinner and more prone to irritation. Here's something many women don't realize. Your pelvic floor muscles directly impact your clitoris. These muscles form a supportive sling at the base of your pelvis, and the nerves supplying your clitoris pass right through this area. When the pelvic floor muscles become too tight, they can compress nerves and refer pain directly to your clitoris. Most minor clitoral bruising heals within 2 to 3 days with proper care. Rest is absolutely essential. No sexual activity until the pain subsides. Cold compresses for 10 to 15 minutes several times a day can reduce swelling and numb discomfort. Anti-inflammatory medications like ibuprofen can help both pain and inflammation. But when should you be concerned? Sharp, electric, and shooting pains are different from bruises like soreness. This could be clitorodynia. These sensations might indicate nerve irritation or a condition called clitorodynia, chronic clitoral pain that persists for months. Pain without any touch or stimulation, burning sensations that don't improve, or visible changes like sores or significant swelling warrant medical evaluation. Prevention is always better than treatment. Use adequate lubrication during any sexual activity generously and reapply as needed. Choose breathable, well-fitting underwear and avoid seams that hit directly on sensitive areas. For cyclists, ensure proper bike fit and consider padded shorts. Communication matters too. Talk openly with partners about what feels good and what doesn't. Start gently and build intensity gradually. Your comfort should never be compromised. Here's something particularly important. Many cases of persistent clitoral pain are actually related to pelvic floor muscle tension. When these muscles stay chronically tight, they create a cascade of problems, including nerve compression and reduced blood flow. This is where progressive muscle therapy becomes incredibly valuable. Working with appropriately sized tools to gently release pelvic floor tension can significantly reduce or eliminate referred clitoral pain. It's about teaching your nervous system that pelvic touch can be comfortable and safe again. The emotional impact of clitoral pain shouldn't be underestimated. It can affect your confidence, your relationships, and your overall quality of life. Remember, experiencing this doesn't make you broken or abnormal. Your pain is real, valid, and treatable. If you're dealing with persistent discomfort, don't suffer in silence. Pelvic floor physical therapists specialize in these issues. Vulvar pain specialists understand the complexity of intimate pain conditions. Their right support makes all the difference. To recap, yes, you can bruise your clitoris, and it's more common than people realize. Minor soreness usually heals with rest and gentle care. But when the persistent pain deserves professional attention, your pelvic floor muscles play a crucial role, and addressing the muscle tension can provide significant relief. If tight muscles are contributing to your discomfort, progressive therapy with tools like vulva dilators can help restore comfort and confidence. Don't let pain steal your joy. You deserve to feel comfortable in your own body.